Right, so when I'm out and about in the community, going to events or whatever, and I talk to people and say that I kind of have this holistic approach to doing my dental work, they've usually got a few questions for me. So most people don't really care. They don't say, oh, it's been a while since I've been to the dentist. They usually say something like, I haven't had a cleaning in a while. So many of their first questions have to do with, how do you do a cleaning? How are cleanings different in your office with this holistic approach than in another office? So let me give you a little bit of a rundown of what it looks like when you come in. So first off, when you come in, you're going to meet your hygienist, and they are going to do a full exam of your gums. They're going to record how deep the pockets are around your teeth. And I don't know if you know what pockets are, but it's just the space between your tooth and your gum, and gives us a pretty good idea of how healthy things are, where your baseline is at right now. The second thing that they're going to do is they're going to actually scrape some of the microbes and the bacteria off of your teeth, and you're going to go with them. You're going to look at the stuff. We're going to put it on a screen for you, blown up super big, and you'll actually get to see what kinds of bacteria are living and lurking in your mouth. So you get a much better understanding of specifically what's in there, and gives us a better idea of how we can make this a targeted approach to addressing your specific situation. So a lot of the cleanings that are done here are, we follow many of the same steps that are found in pretty much every other dental office. There's the scraping of your teeth. Everyone's had a scraping done. We use those same kind of tools. Once the scraping is done and things generally are cleaned up, we give you the option to flush out your gums and flush out your mouth with ozone. For those of you that aren't familiar with the use of ozone, it's a really reactive form of oxygen, and it just happens to kill bacteria that lives in our mouth really, really well. Not just the bacteria, but also parasites and fungi and viruses, even like hepatitis B and HIV are susceptible to ozone. We also take a lot of photographs. We want to share with you what we see. There are so many details. If there's a chipped filling or a crack in your tooth, we want to look at those things with you, and so you can see what we see. So everything is out in the open, and our treatment recommendations are going to make sense to you. Also, we offer oral cancer screenings. We use this little light gun thing. We look through it, and it kind of shines a special light into your mouth and can help kind of illuminate the tissue in your mouth if it seems to be turning cancerous or not. We also have a thorough discussion about your home care and brushing and flossing technique. Everyone knows they need to brush and floss. We don't beat this one to death, but if there seems to be a problem with the technique, we like to address it and give you tools so that you can succeed in this task that everyone needs to do. We have so many products that we carry here in the office that we stand by and we use ourselves. So if you're curious about different product options out there, and you want to switch things up a little bit, we've got lots of choices here, and our hygienists are trained to discuss the full array of choices that you have. And the last thing we do, we talk about how often you should be coming in for a cleaning. Everybody has different risk levels for gum disease and various other concerns that we could have. And so we try and give our honest opinion about where we think you should be at and how often we should be seeing you in the office. So to just kind of summarize, when we're taking this whole body approach, we want to target our cleanings, dental cleanings, to the types of bacteria that are there. We want to hit those hard to reach places with different products that are going to clean them up really, really well, like ozone. And we want to provide you an honest opinion of where we think you should be at, and what we can do to help, and then provide any information that you need for the products that we've got, so that you've got good, healthy choices that are effective as well.